So I want to show you now what your alveoli looked like, probably, when you were infected.
So what, are they full of fluid?
In Rosie's lungs, the COVID virus had infected the cells along the air sac walls. And as the body's immune cells struggled to overcome the virus, they filled the air sacs with their corpses.
It's a mixture of fluid, mucus, dead cells.
It's nasty stuff.
Yeah.
It's not,
Yeah, and it's filling the space that should be full of air. And that's why it was so hard for you to breathe.
So it's almost like drowning. Quite unbelievable.
Of the inflamed areas of Rosie's lungs that were affected by COVID 7 weeks ago, more than a quarter of the air sacs were completely full of fluid and unable to help her breathe.
How does it feel to see it like this?
Well, it feels very good to be on the other side of it, that's for sure. It's very hard to take in.
And Ernie, what? COVID.
The treatment, Rosie, was all around how can we stop the lungs from getting more and more inflamed.
To reduce the inflammation and essentially save Rosie's life, Dr. Ernie Wong prescribed medication that was the result of international trials involving Imperial College Healthcare NHS Trust. He also had her fitted with a CPAP, a respiratory machine that wraps around her face and head and pushes oxygen-rich air into her lungs.
I'm claustrophobic, and the thought of having something clamped tight to my face and you can't see properly, I couldn't do it. There was one particular nurse who was out of this world, and he just sat there for hours. We're going to do this. We're going to do this together. This is going to save your life. Sorry for my tears.
No, it's totally right.
It was quite awful. But as I say, the staff were outstanding.
Awful that she got sick, but if she was going to get sick, better now than right at the start, you know.
Indeed, but you know, I'm somewhat humbled because I know that you're going through a lot, far worse than we went through.
Well, it's very sweet of you to say so, but actually, his lungs are doing better. You know, he's out of the coma, he's off the tracheotomy, he's breathing on his own. But the damage is throughout the whole body. But, you know, you can see the impact even just on the lungs, can't you, like that? It's going to be huge.
Although nowhere near as badly affected as my husband Derek, Rosie also hasn't fully recovered. She suffers with extreme physical fatigue, which could be the result of permanent lung damage.
I'm absolutely petrified it may happen again, but I would like to know how we should medically go forward from here.
It gets fibrosis.
Our usual
and
next
it's
step
permanently
would be
damaged.
repeat
It
chest
can't
X-ray
recover.
to see if there's any ongoing
Only thing
damage or
is,
scarring in
we
the
have to
tissue.
compensate
Some patients,
with the normal
even
remaining
after they've
healthy
fully
lung
recovered
tissue.
from the COVID infection, may well be breathless in the long run. So this is something that it's really important for us to capture.
I'm just very grateful to have had this amazing opportunity, which I'm sure most people don't get.
Cheers.
What did you think?
It's the most fascinating thing I've ever seen in my whole life. It was just unreal.
Did you see your heart pumping away there?
Thank God. I'd be more worried if I hadn't seen it pumping away.
You'll never take a breath in again the same way, will you?
I will never see life in the same way again. I'm just hoping that although there is going to be a scar on my brain forevermore, that will be the most of it, and we can carry on with our lives, with our kids and our grandkids and all the pleasures that God gives us in this world.
Well, best of luck, and we'll catch up with you then.
Thank you.
Thank you for sharing such an extraordinary moment with you today.
Thank you.
Rosie will need a scan in 2 months' time to determine if there is any long-term damage to her lungs.
So if we think we are having a mild symptoms, or we say it's a normal, just a flu, but it is not, we should test. If it is positive, we should take care and we should take medical advice, because even if we have a mild symptoms, we ignore it, but where it infected in lungs, on exocrine glands, parotid glands, pancreas, or even in endocrines, hearts, arteries, everything, it damages it and it becomes irreversible damage. So we have to
X-ray imaging, which allows Nick to navigate his way through.
We're in the prostate artery. We're just manoeuvring the catheter now to get in a good position to put the particles in. Hundreds of tiny particles, 250 microns in size, to block all the really tiny arteries inside the gland. But Adrian's got quite a big gland, and so he's taking quite a lot of particles. That's the four. Great. So, Adrian, how are you doing?
All right.
Any strange sensations anywhere?
Still here, no, just
Penis feels okay?
me what?
The penis?
Yeah. Well,
Okay.
yeah.
Not hurting?
No. No.
Okay, that's good.
It's looking good, and after repeating the whole procedure on the other side of the prostate,
That's the one we want to go into. That's good.
Nick's work is done.
That's good. Great. Okay. Fantastic.
Go get a cup of tea.
Yeah.
Good time fly when you're having fun.
Good. See you a little bit later, Adrian.
Thank you. Thank you very much.
But only time will tell if the procedure has really worked.
The next couple of days will be a clincher for me. So I'm going to be constantly now waiting to see what the
prostate
improvements are.
arteries are blocked,
Gauging it
and
on
hopefully
every
it will reduce the size of the prostate and will recover some sign symptoms. It will be bit mild.
71-year-old COVID survivor Rosie is making her way back to St Mary's Hospital, where just 3 months ago she was here fighting for her breath and her life.
When I was at the front entrance, it was okay. Coming to see my ramp here, which was where I steep today.
Having seen in the imaging centre the severity of what COVID did to her lungs,
Oh my goodness, it's so much.
today she's having a scan to see if it has caused any permanent damage.
So now you will see
The X-ray will be
previous
analysed by
inflamed lungs
consultant radiologist
and
Professor
after the
Susan
treatment.
Copley.
The X-ray is
And
very
compare
important.
it.
It's a really vital part of the jigsaw to determine whether she's actually on the road to recovery.
Okay, Rosie, take a big breath in.
And I very much hope that the abnormalities that we saw on the initial CT have resolved or are significantly improved. We won't know that for sure until we see her chest X-ray.
And breathe out. Okay, all finished. Thank you.
In a week's time, Rosie will get the results of her X-ray.
Certainty of all the things that go with COVID, I think will never go away. If you want the truth.